Rickettsial disease and scrub typhus. First, we are going to talk about rickettsial disease. These are the diseases caused by rickettsia, which are small gram-negative bacilli adapted to oblique intracellular parasitism and transmitted by arthropod vectors. These organisms are primarily parasites of arthropods such as lice, fleas, tick, and mites, in which they are found in alimentary canal. Invertebrate, including humans, they infect the vascular endothelium and reticuloendothelial cells. Commonly known rickettsial disease is scrub typhus, causative agent of scrub typhus. The family Rickettsia currently comprised of three genera, Rickettsia, Orientia, and Enrelichia, which appear to have descended from the common ancestor. Scrub typhus or jigar-borne typhus or Susugamushi fever is caused by Orienta Susugamushi. Orientia is a small tiny gram-negative bacterium of family Rickettsia, 0.3 to 0.5 by 0.8 to 1.5 micrometer. It differs from the other member in its genetic makeup and in the composition of cell wall structure, since it lacks lipopolysaccharide and peptidoglycan and does not have any outer layer. Now, in Indian scenario, in India, scrub typhus have been reported in Rajasthan, Jammu and Kashmir and Vellore. In addition, few cases have been tested positive for IgM antibody for scrub typhus from Sikkim, Darjeeling, Nagaland and Manipur. In study conducted from July to October 2004 in Himalayas, among several cases of acute febrile illness of unknown origin, Orienta Susugamushi was identified as causative organism by microimmunofluorescence and PCR tests. Recently, in 2022, few cases were reported from the Kerala. Disease transmission. Scrub typhus is transmitted by the mite Leptotrombidium deliens. Human beings are infected when they trespass into the mite island and are bitten by the mite larvae like chigars. The mite feed on serum of warm-blooded animals only once during its life cycle and development. Adult mite does not feed on the man. The microbes are transmitted transovarial in the mites. Incubation period is generally 1 to 3 weeks. Now, clinical picture. A papule developed at the site of inoculation. The papule ulcerate and eventually heals with development of black scar. In general symptoms, sudden rise in fever more than 40 degree with relative bradycardia, severe headache, apathy, myalgia, generalized lymphadenopathy, photophobia and dry cough. Approximately 1 week later, a spotted and then maculopapular rashes appear, on first on the trunk and then on the extremities. Blenches within the few days. Complication like interstitial pneumonia developed in 30 to 65% of cases, meningoencephalitis and myocarditis. Symptoms generally disappear within 2 weeks or even without the treatment. In severe cases with pneumonia and myocarditis, mortality may reach up to 30%. Now, common clinical manifestation and complication of rickettsial disease. Rickettsial disease enter by bite of tick, flea, louse or mite, then spread by lymphatic or hematogenous spread. Now, development of the disease is done by encephalitis, pneumonitis, rash or nausea, vomiting, kidney failure and then exit of the bacteria. Now, diagnosis. Routine laboratory tests are unlikely to be diagnosis for any rickettsial disease. Early lymphomia and late lymphocytosis. Albuminuria is common laboratory finding. Thrombocytopenia is observed more than half of the patient with epidemic typhus. Laboratory diagnosis. Scrub typhus may be diagnosed in laboratory by isolation of the organism. Serology, molecular diagnosis like PCR. Several serological tests are currently available for diagnosis of rickettsial disease like Wilflix test, IIF, indirect immunofluorescence, ELISA, etc. Now treatment. Tetracycline and chloramphenicol remain only proven treatment for rickettsial disease. Doxycycline in a dose of 100 mg twice daily for 7 to 15 days, or chloramphenicol 500 mg 4 times a day per oral for 7 to 15 days. For children, 150 mg per kilogram per day for 5 days is recommended. Tetracycline may cause discoloration of the teeth, hypoplasia of the enamel and depression of the skeletal muscle growth in the children. Therefore, tetracycline should not be given to the children under age of 8 years and for pregnant women. Now, prevention and control of the rickettsial diseases can be eliminated by treating the ground and vegetation with residual insecticide, reducing rodents population and destroying limited amount of the local vegetation. A person who cannot avoid the uh, infected terrain should wear protective clothing, impregnate their clothes and bedding with miticide like benzyl benzoate and apply mite repellent diethyl toluidamide to exposed skin. Chemoprophylaxis should also be considered, and the weekly administration of the 200 mg doxycycline decreases the incidence of clinical illness but not the inapparent infection. Thank you.